What can I do about uneven eyes?
Eyes and eyelids which appear to be asymmetric may be distressing when first recognized. In actuality, facial asymmetry is universal. Even famous actors and models who appear to have perfectly symmetrical faces have asymmetric features, including in their eyes. It's important to also recognize when asymmetry is greater than what is generally inconspicuous. I'll discuss the common causes of asymmetry in the eyes and eyelids and when eyelid asymmetry may be improved with medical procedures. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform cosmetic upper eyelid surgery to treat different causes of asymmetry every day in my practice. For example, I perform upper eyelid blepharoplasty for hooded eyes, Asian double eyelid surgery to create an eyelid fold or crease, as well as eyelid ptosis surgery to treat upper eyelids which are lower than they should be. I also perform non-surgical treatments such as the placement of injectable fillers above the upper eyelids when hollowing makes the eyes look droopy or uneven. People often assume that perfect facial symmetry is the ideal, particularly in the eye area. In reality, facial asymmetry occurs naturally and is a reflection of the facial bone structure. During fetal development, the two sides of the face form separately and meet in the middle, so one side of the face always projects more than the other side. This means that the eye sockets can have a subtle difference in position, so the two eyes will consequently have some subtle difference between them. Since eye position is due to bone structure, it's not something that I routinely recommend pursuing a solution for to optimize symmetry. The bone structure can also affect the appearance of the soft tissue around the eyes. This can result in one eye appearing to look more hollow or hollower than the other eye. Hollowing above the upper eyelid can also be due to prior upper eyelid surgery where in some situations fat was removed too aggressively. Hollowness can also be due to aging changes caused by bone and fat volume loss. I generally address upper eyelid hollowing by using a soft hyaluronic acid filler, such as Restylane L or Juvederm XC. Although surgical procedures such as fat grafting can be performed, I prefer the predictability and convenience of hyaluronic acid fillers. Having performed fat grafting procedures for hollow upper eyelids before the introduction of hyaluronic acid fillers, I can attest to the challenge of fat grafting predictability. A significant percentage of the fat that is placed just doesn't survive. In addition, there is a challenge in the healing process where the eyes can be fairly swollen afterwards. Since a significant percentage of the fat doesn't survive, asymmetry continues to be a problem, which means another fat grafting procedure would typically be indicated. In contrast, I routinely place hyaluronic acid filler into this same space in my exam room with local anesthesia, and my patients are able to go about their day with minimal swelling. I routinely see them 2 weeks after placement, and if additional filler is needed, I can perform the procedure at the same time. As far as upper eyelid height is concerned, in my specialty, we generally agree that a difference of 1 to 2 millimeters between the height of the two eyelids is within the normal range and doesn't draw attention. Of course, while other people don't see this difference when they look at you, some people who look at their own eyes notice this difference and become very concerned. If both eyes appear to be of normal height and there is no more than a 2 millimeter difference between them, I usually don't recommend any aesthetic procedure. If there is a difference in the height between the eyelids that's greater than 2 millimeters, I determine if one or both of the eyes are affected by a condition called ptosis. The word ptosis means droop. The causes of ptosis are typically related to the muscles which lift the upper eyelid, such as the levator muscle. Typically, a surgical procedure is needed in order to address ptosis. The type of ptosis surgery that needs to be performed is determined by the eyelid height and strength of the levator muscle, in addition to other eye-related issues. For many of my patients who are concerned about the cosmetic appearance of asymmetry that is relatively subtle between their two eyes, I'll often perform ptosis surgery from behind the upper eyelid. By performing ptosis surgery in this way, my patients have little downtime and they appreciate the improvement in their symmetry fairly quickly. Noticeable eyelid asymmetry can be due to hooding in the upper eyelids. Hooding is due to stretching or redundant eyelid skin, which is often associated with aging. Eyelid skin causing hooding is referred to as dermatochalasis. The term or the procedure to address dermatochalasis is cosmetic upper eyelid surgery, also known as upper eyelid blepharoplasty. While upper eyelid blepharoplasty is a procedure commonly performed by various surgeons from different disciplines, I cannot overstate the importance of recognizing and appreciating the complexity of determining the optimal amount of skin to be reduced and the artistry involved in the design of the skin removal. It's also important to recognize that upper eyelid blepharoplasty is not simply a skin removal procedure, but rather it is a procedure where the deeper tissues, including fat and muscle, is contoured to create a natural appearance. One area I specialize in is to help people from around the world who have had complications from cosmetic eyelid surgery. For example, the removal of too much upper eyelid skin can result in the inability of the upper eyelid to actually close and protect the eye, resulting in potential visual compromise. For patients who have this type of problem, I have no choice but to perform skin graft surgery so they can close their eyes more comfortably and protect their eye. I also often consult with patients who come to me after having cosmetic eyelid surgery performed elsewhere because they feel that their surgeon removed too much fat, or they feel that their eyes look too rounded and now they don't feel like they recognize themselves. Essentially, they're distressed because they feel that they've lost the character of their appearance of the eyes. Noticeably asymmetric eyelids can be due to not having an eyelid crease or having a shallow or undefined eyelid crease. This issue is of great significance for some people of Asian backgrounds. It is generally understood that about 50% of people are born without eyelid creases or sometimes have a defined crease in one eye and not the other. Having a shallow crease or multiple creases over one eye can also affect the symmetry between the two eyes. Anatomically speaking, eyelid crease definition is due to a connection between the eyelid skin and the levator muscle. If these connections are incomplete, then the creases can be shallow, or there can be multiple small creases, or even no crease at all. The foundation of Asian double eyelid surgery is to create a connection between the eyelid skin and the levator muscle. For younger patients without excess skin or fat interfering with crease formation, a non-incisional procedure can be done where sutures are passed through the eyelid skin and the levator muscle without removing any fat or skin. In patients where there is extra eyelid skin and fat obstructing a crease from forming, an incisional double eyelid surgery can be performed. In these patients, excess eyelid skin and fat is removed before suturing the eyelid skin to the levator muscle. I perform my eyelid surgeries under local anesthesia with light IV sedation, so patients are comfortable and they usually return to work in about a week. Before considering treatment for uneven eyes, it's important to have an appreciation for what is just normal asymmetry. If asymmetry is significant, then a proper evaluation is needed to determine the most effective strategy that will work for you. I hope you found this information helpful. Thank you for your question.